Good afternoon from Miami. This is Dr. John Bennett from the studios of Neurosurgical TV. Today we have the pleasure of having Nourou Bankol, a neurosurgical resident from Morocco, who's going to present on sphenoid bone skull base anatomy. But let's first meet the panelists. Can the panelists please introduce yourself, please?
Okay. Hello, everybody.
So hold on, Nourou. Let's meet the panelists, okay? And I'm going to have to bump you off the screen share because we want to see their face.
Okay.
Hold on.
Yes.
Okay, Nathalie, could you please introduce yourself?
Okay.
Yeah.
Hold
Hello,
on, Nathalie.
everybody.
Go ahead, Nathalie.
Hello, everyone.
Go ahead. Go ahead.
Yes.
I'm Nathalie. I'm Dr. Nathalie. I'm a medical doctor from Cameroon and aspiring neurosurgeon.
Very good. Welcome, Nathalie. Cherubin, can you hear me okay? He may have stepped away. Okay, Nourou, welcome, and please introduce yourself and on with the presentation.
Okay. Hello, everybody. Hello, John. It is a pleasure to me to be there today. I am Nourou Bankole. I am a resident of neurosurgery here in Morocco, and it is a big pleasure to me today to present to you the sphenoid bone skull base anatomy. So thank you, everybody, to come. So hello, everybody. I have to present you to this afternoon sphenoid bone skull-based anatomy. I will use this plan introduction. I will talk about parts about this beautiful bone, who is very complex, very complex bone. And we will talk about clinical significance neurosurgery approach. And after we will conclude. So we will talk about body of sphenoid, greater wings, lesser wings, and pterygoid process. We will talk about all these parts of sphenoid bones. So in introduction, as you can see, the sphenoid bone, also sphenoidal bone, come from Latin, who means sphenoidal. It is a single bone that lies in the base of skull between the frontal, temporal, and occipital bones. The sphenoid bone has a central body and paired greater and lesser wings that extend laterally from the body of the sphenoid, and two pterygoid processes descending from the junction of the body and greater wings. It is an important bone of skull who give landmark of skull-based neurosurgery. Different approach. So all neurosurgeons in the world have to know the landmark who can give this complex bone in neurosurgery. The main parts of the sphenoid bones are the body of sphenoid, like here in blue, the body of sphenoid. You have two lesser wings of sphenoid and two greater wings of sphenoid, lateral part of the body of sphenoid, and we have two pterygoid process laterally again, laterally part of the body of sphenoid and posterior. So we will talk about the body of the sphenoid. The body of sphenoid is the central. The body of sphenoid is the central portion of the sphenoid bone located between the wings and process pterygoid of sphenoid and housing the sphenoidal sinuses. The sphenoid body has 6 surfaces, like you can see: superior, inferior, superior and inferior, lateral, 2 parts lateral, and you can see posterior and anterior surface. We're gonna go quickly about the superior surface. The superior surface of the body of the sphenoid present the following landmark. You have to know about your anatomy. It is the landmarks. The landmarks have about body of sphenoid. It is the chiasmatic groove. Chiasmatic groove, you have a sella turcica. I will come back with more detail in a few moments. We have hypophyseal fossa and the tuberculum celle and the dorsum celle. So we're gonna go to describe now chiasmatic groove. The chiasmatic groove is a groove between the right and left optic canal. You can see here the body of sphenoid has two canal optic, one canal optic in right side and one canal optic in left side. And between these two canal optic, you have optic groove, as you can see here. And you have the sella of turcica. So here is a depression on the body of the feet, which lies above sphenoidal sinus and contain hypophysis. Here it is the place of hypophysis gland. The hypophyseal fossa is a depression, as you can see here. It is the depression on superior surface of the sphenoid body, where you have the gland, the pituitary gland, like here. And you have the tuberculum celle. The tuberculum celle is this small process in front of the hypophyseal fossa. And the dorsum celle is the posterior wall of the hypophyseal fossa. And laterally, you can have here the carotid groove. Here, it is the carotid groove laterally dorsum celle. You have laterally here the carotid groove, whose name is Lesse foramen lacerum. The carotid groove, when you have to describe that with more details, the carotid groove is a longitudinal groove here, laterally of the sphenoid bone, that houses the internal carotid artery and the posterior surface of the body of the sphenoid, joined with the basilar part of the occipital bones, like you can see here, the basilar part of occipital bones, and you have here clivus. And laterally of the body of sphenoid, you have carotid groove. And the anterior surface of the sphenoid body present opening of sphenoid sinus. You have two sphenoidal sinus and the septum between sphenoidal sinus. I'm going to show. You have here the sinus sphenoidal, and here we have this. You have here the septum between these two sinus sphenoidal. So the opening of the sphenoidal sinus is an aperture that opens anteriorly into the nasal cavity, specifically into a small space called the sphenoethmoidal recess. And it is good landmark who want to perform endoscopy, neurosurgery, but macroadenoma, and then. The sphenoidal sinus is a pair, and that is paranasal cavity located within the body of the sphenoid. The septum of the sphenoidal sinus, like I was said, it is here, is bony partition separating these two sphenoid sinuses. The inferior, we have here this inferior surface of the sphenoid body who present in the middle line a triangular spine called the sphenoidal rostrum. Here it is the sphenoidal rostrum. It is a great landmark to for the neurosurgeon when we're going to done endoscopy surgery, transsphenoidal approach. It is good landmark before we enter in the sphenoidal. So we're going, and we'll come back. We're going to talk now about the greater wings of sphenoid. The greater wings of the sphenoid are the larger part. So you can, as you can see, I'm going to talk about greater wings of sphenoid. The greater wings of sphenoid, like you can see here, the greater wings of sphenoid are the larger of the two lateral wing-like extension of the sphenoid body, like you can see here on the right and on the left. The greater wings curves upward, lateral, and backward to form a prominent concavity or fossa in the middle of the cranial floor. Each greater wings of the sphenoid has 5 surfaces: cerebral surface, 2 parts of the lateral surface, infratemporal, maxillary, and orbital surface. I will go to show you that in more detail in a few moments. The cerebral surface of the greater wings of sphenoid forms the anterior part of the middle cranial fossa, and this surface has the following feature, like you can see: the foramen rotundum, you can see here correctly, have the foramen rotundum, a foramen spinosum, a foramen oval, and impression of gyri and atri groove. The foramen rotundum is a circular hole in the greater wings of sphenoid bone connected the middle cranial fossa to the pterygopalatine fossa. It is a passage for the maxillary branch, as you can see here, of the trigeminal nerves. Don't know what. Okay. Here, okay. Here it is foramen rotundum. Foramen oval here is an opening in the greater wings of the sphenoid connected the middle cranial fossa to the external surface of the skull and transmitting several vessels and nerves through the skull, including the mandibular nerves, the motor root of the trigeminal nerves, and the lesser petrosal nerves. You can see all this here. Okay. And the foramen spinosum. The foramen spinosum, you can see, is a round, small opening in the greater. It is here. I will show you. It is here. This foramen spinosum is a round, small opening in the greater wings of the sphenoid located posterolateral to the foramen oval and connected to the middle cranial fossa. You see here, just inferior temporal lobes, parietal lobes, and it is transmitted the middle meningeal artery and vein and the meningeal branch of the mandibular nerves. It is very difficult to do it in, yes, you can see here, the middle meningeal artery, trigeminal ganglion, mandibular nerves, and maxillary nerves. And the impression about the cerebral gyri, also called the digital impression, you can see just this impression of brain. So that is called digital impression, or flat indentation on the inner surface of skull corresponding to the cerebral gyri, which produce them. The arterial grooves, like you can see here, are located on the inner surface of the skull, produced by pressure from artery, primarily the middle meningeal artery and its branch. The lateral surface of the greater wing of the sphenoid is convex and divided by a transverse infratemporal surface. The infratemporal crest is a bony ridge between the upper vertical temporal surface and the horizontally oriented lower infratemporal surface of the greater wings of the sphenoid bone. The lateral surface is pierced by foramen oval and foramen spinosum, like I show, and feature the down projecting sphenoidal spine. It is the rotundum spinosum. Yes. The temporal surface of the greater wing of the sphenoid is the attachment site for the temporalis muscle. You can see here that is line, supratemporal lines. This is the temporalis muscle. The infratemporal surface of the greater wing of the sphenoid is directed downward, and together with the infratemporal crest is the attachment site of the upper fibers of the lateral pterygoid muscle. And the maxillary surface of the greater wings of the sphenoid faces anteriorly forms the posterior border of the pterygoid fossa, pterygopalatine fossa, and is perceived by the foramen rotundum. Like you can see here, all this here, it is the pterygopalatine fossa. It is here, all this. You have here the greater wings of sphenoid, the maxillary. Can describe more. The orbital surface, as you can see, it's very important to know this fissure, names superior orbital fissure and inferior orbital fissure. It is very important to know this landmark because they inside this fissure you have artery, vein, and nerves who will come out. I will go quickly. I will talk now about lesser wing of sphenoid. The lesser wing of the sphenoid are the smaller of two lateral wings, like extension of the sphenoid body. The lesser wings are flattened triangular in shape and located above and anterior to the greater wings, like you can see here. It is the lesser wings, and here it is the greater wings. You can see in this view, superior view, the lesser wings, like that. And here, it is the greater wings. And it is very important to know this landmark when you have to done, like example, that sometimes we take it like K all. So the laser wings and flattened triangular in shape and located above and anterior to the greater wings. Each laser wings of the sphenoid has two surfaces, cerebral and orbital. So we have this surface and this surface, orbital and cerebral surface. We have optic canal and anterior clinoid process, which is very important landmark in neurosurgery. The optic canal is a passage in the sphenoid bone connecting the orbit to the middle cranial fossa. The optic canal transmits the optic nerves and the ophthalmic artery. The anterior clinoid process is a cone-like process of the sphenoid on either side of the anterior parts of the hypophyseal fossa. The lesser wings of the sphenoid also contribute to forming, like I show We have the orbital structure, which between the greater and lesser wings of the sphenoid bone, bordered medially by the body of the sphenoid and closed at its anterior extremity by the frontal bone. We have here the anterior clinoid process, and here the posterior clinoid process. And we're going to show you more again. Pterygoid process is a paired posterior-inferior projection of the sphenoid bone, each bifurcating into a medial and lateral plate. You can see here the medial plate and the lateral plate. Each pterygoid process also feature, you have two features, pterygoid fossa and pterygoid canal. We're going to talk about that. The lateral plate of the pterygoid process is the lateral division of the pterygoid process where the pterygoid muscle attach the lateral pterygoid muscle to the lateral aspect and the medial pterygoid muscle to the medial aspect of the lateral plate. The medial plate of the pterygoid process is the medial division of pterygoid process, and the superior pharyngeal constrictor muscle, like you can see here. I can show you more because I have. And I was talking about the medial plate of the pterygoid process, who is the medial division of the pterygoid process, the superior pharyngeal constrictor muscle, give attach here. The superior pharyngeal constrictor muscle attached to the inferior end of these plates. The pterygoid fossa is a space between the lateral, you can see here, the pterygoid fossa. The pterygoid fossa is a space between the lateral and medial plates of each pterygoid process of the sphenoid bone. The pterygoid fossa is attachment site of the medial pterygoid muscle. You can see here, pterygoid muscle. The pterygoid canal is bone. The pterygoid canal is a bony passage that extends anteriorly in the base of the pterygoid process of the sphenoid bone, and the pterygoid canal transmits the greater and deep petrosal nerves from the middle cranial fossa to the pterygoid ganglion in the pterygopalatine fossa. You can see here the pterygopalatine ganglion, the nerves, nerve of pterygoid canal from greater petrosal, and this space, it is this ganglion is pterygopalatine ganglion. And like I was showed you, you can see here again the carotid canal. You can see the carotid canal here, the pterygoid canal here, and lateral pterygoid plate here. And laterally we have foramen oval, foramen spinosum, and the jugular foramen. Okay. So, are we going to talk about clinical significance? The sphenoid bone shares a close anatomical relationships with the pituitary gland. Indeed, the pituitary can be accessed surgically by passing instruments through the sphenoid bone and sinus. This type of surgery is known as endoscopic transsphenoidal surgery, and it is the usual treatment of choice for pituitary adenoma. It is allowed for the surgical management of pituitary pathology without the need for a more extensive. So we can see this landmark. You have nasal cavity here. You have the sphenoid sinus, and here I talk about this spine crate. And we have here the hypophyseal fossa, and you can access directly to remove pituitary gland adenoma. We can use more approach when you know correctly this anatomy of sphenoid bone, like this pterygoidal approach. I love this approach, pterygoidal approach. Always that to repair your pterion and remove that. And in meningeal classification, you can see here clinoid anterior and posterior meningeal, lesser wings of left sphenoid could be invasive about tumor. And like you can see here, sometimes the middle meningeal artery, when you have hematoma, extradural, epidural, or epidural hematoma, and when you have to done craniectomy decompressive, you have to repair this pterion and put your keyhole, first hole of trepanation here. It's very important to know this bone correctly. And in conclusion, the sphenoid bone is the most bone complex of skull base. It is the way to perform skull base surgery. It is very important to learn his anatomy that make the light in the way of neurosurgeon skull base surgery. So thank you for your attention, and your comments and approach are welcome.
Okay, thank you very much, Nourou. Well illustrated, very clear. And I'm not a neurosurgeon, but I can see how central it is to understanding neuroanatomy, that area. But let's start off with Marco. Say hello to Marco. And Marco, how you doing? And can we have your comments, Marco, on the sphenoid bone and how important it is, and anything else you can tell us about the sphenoid, please?
Sphenoid bone is obviously very important, as just highlighted the young neurosurgeon or young neurosurgeon, because it is critical in several approach. He highlighted in particular the pterional approach with the keyhole. Is very important. It's important when you approach the anterior arteries of the brain, and you need to follow the great wings of the sphenoid to join the carotid cistern and find the anterior arteries like the anterior cerebral artery and the communicated artery. So it's absolutely very important as well for the transsphenoidal surgery. The gold standard in the therapy for hypophyseal macroadenoma. So skull base need a great knowledge of the sphenoid bone, absolutely. And I will congratulate you for your presentation, Nourou. It's very brilliant, and you highlight in a very fine way the relation with the surgery of the sphenoid bone. Very good.
Thank you very much, Mr. Marco Meloni. Thank you very much.
You're welcome.
Well, it seems that endoscopists spend a lot of time in that area, right? The sphenoid bone, a lot of transsphenoidal pituitary surgery. Any other type of surgery in that area that neurosurgeons do?
Yes, of course.
Okay, I'm not a neurosurgeon. Obviously.
Yeah.
What kind of surgery is done in that area?
Are you asking to me, John?
Well, whoever.
Oh, okay. In the sphenoid bone, obviously the pituitary surgery, endoscopically. is absolutely the main surgery. What else? Obviously, you can see all the anatomical relationship with the sphenoidal bone. So, is surgery for the aneurysm of the anterior cerebral arteries, for can be for the optic nerve, and obviously the cavernous aspect of the HICA, so meningioma of the tuberculum cell, or of the great wings of the sphenoid. So meningioma are most common localized in the great wings of the sphenoid, with a relation with the middle meningeal arteries, that is the main vessel that feed the meningioma. So in this case, the knowledge of the sphenoid bone anatomy is absolutely important and needed for a neurosurgeon.
Okay, is there any open pituitary surgery now, or is it all done endoscopically?
Yes, but it is not always endoscopy, because sometimes when you have a big macroadenoma and it is more invasive chiasma optic, you can perform endoscopy. You have to go in to frontal approach. So,
okay.
like Dr. Meloni said, sphenoid, 90% of surgery in neurosurgery, you have to know anatomy of sphenoid bone. We are always use the landmark of sphenoid bone, always.
Okay.
In traumatic surgery, tumoral pathology, always we use sphenoid bone landmark
As a reference point.
Yeah, it is reference. It is reference to the keyhole. It is reference. Yeah.
Okay. Okay.
Yes.
Okay. Hamad, are you like to introduce someone we haven't met yet? Hamad, are you there? I don't know. He may have stepped away. And
I think that Hamed Badar, it is one physician. It is a it is a doctor in pharmacy. And
he was on the screen briefly. I don't know. Hamad, are you there yet? He said thanks. Oh, there we go. Could you unmute?
Hello,
There you go. We'd like to meet you.
Hello, everybody.
hello.
Yeah, where are you from, Hamad?
Thank you. I'm from Senegal.
Oh, God, welcome. Very good. Very
Thank
good.
you. Thank you.
I hope you're not driving.
Yeah. It's very difficult for my my bureau. Well, my office is very don't have place,
Well,
but
that's great.
want
That's great. You're accessing it. That's great.
okay, very good.
That's great to keep in touch and welcome.
Yeah.
That shows the versatility of this technology. You can do it. We've had a few people, and Marco will tell you, from
Exactly.
cars. Some people then you can
Okay.
actually make a presentation on a smartphone, a PowerPoint presentation. So
yeah, Cherian did, right?
Yeah, I've done it. We had a Chinese neurosurgeon do it from the parking lot of the hospital on a smartphone.
Yeah, I remember.
Yeah, that was the first time I've ever seen it. So,
Okay.
very good. I think we have someone coming in.
Thank
Ulrich is
Thank
here.
you.
Ulrich, say hi and meet everybody. Ulrich is, I think he's the person that put this series together of neuroanatomy.
Yes.
Well, yeah, we'll say hello if he can come in here. Well, he may have dropped off. Okay, very good. Thank you very much, Nourou, for taking the time. You look
Thank
great. You sound great. The presentation's very clear, and you could put it in your portfolio, your video portfolio.
Okay, it's good.
And thank you all the panelists for. Oh, Sydney. Okay, wait a minute. Hello, Ulrich. Can you say hello to everybody?
Hello, everyone.
Yeah, hello, Ulrich. How are you?
Fine, thanks. I'm so sorry I missed your presentation.
No, don't
I had
worry.
an emergency.
That's okay. We
I had a family
understand.
emergency.
Okay.
And
It's okay.
it's recorded. We'll send it to you, Ulrich. So you
Oh, okay,
can
okay,
see
that's
it.
great.
Because as we were talking about, the sphenoid bone is so important, central, it seems. It seems to understanding neuroanatomy. Thanks everyone for coming, and we'll end this broadcast, and we'll see you in the next of the series next Friday. Adios, everybody.
Yes, adios.
Okay.